I just woke up with some eye boogers, crusts in the corner of my eyelids. Is that normal, and what can you do about it? Let's focus in. Now, this is something that people experience multiple times in their life, and it goes by a bunch of different names. You got eye boogers, eye goobers, eye crust, sleep, gunk, goop, and it is completely normal. It's naturally occurring. But the question is, what happens when it gets out of control or you have more of it? So let's go over what it is and how do you get rid of it. The eye crust, and this might get a little gross, is a mixture of old skin cells, sloughed off cells, as well as tears and mucus. Now you can get these dead skin cells from the eyelid, but a more common place is actually from the cornea, the clear dome in front of your eye where contact sits. That top layer of cells actually rejuvenates and sloughs off cells every 2 days. And so it's in this constant rejuvenation and shedding old cells. And the rest of it actually comes from the tears. The innermost layer of the tears is the mucin or the mucus layer. That's a protective layer from allergens and bacteria. And then you have the water portion of the tears that comes from the lacrimal gland tucked up above your eyelid. And then you have a top layer that's the oil layer that comes from the oil glands of your eyelids. And so when you have the tears, the water and the mucus mixing with the old cells, it forms something called rheum. And again, this is naturally occurring. We just constantly produce rheum, and our eyes actually rejuvenate and regenerate and flush it out through the tears. Every time we blink when we're awake, we're pushing out that rheum through the puncta of our eyelids, little holes in our eyelids, and it flushes down the lacrimal duct. Now, when we go to bed and we're sleeping, we aren't blinking. And so that rheum dries up and forms into a crust, the eye boogers. Now let's go over 3 reasons what can cause more of this sleep crust and how you can help it. The number 1 reason would be dry eyes, and more specifically, evaporative dry eye or meibomian gland dysfunction, MGD. This is usually where the oil glands in your eyelids aren't functioning really well. Either they're not producing enough oil, or the quality of the oil is thick and doesn't provide a good protective layer over the tears. And if that oil's not there, that allows the tears to evaporate much faster, leaving your eye exposed to the air, and it dries out. Now your eye's response to this will produce more water from the lacrimal gland to compensate for it. And when you have an increase in water from the tears, and when the surface of the eye is exposed, you might have more cells that get sloughed off, and then you'll have that mixture that creates more rheum that dries out and forms more crust at nighttime. Now, unfortunately, treating MGD or meibomian gland dysfunction can be a battle, can be tricky, and sometimes take longer than you'd like. And this may be something that you'll have to come up with a management plan, a dry eye treatment plan with your doctor. But there are some home remedies that people can try out that may be helpful. That would include preservative-free artificial tears throughout the day. Now, more specifically, these artificial tears would need to have an protective oil layer in the tears. This could include Sustain Complete or Optase MGD. Both are great options. You can look into taking omega-3 supplements. Again, talk to your doctor about this, but omega-3 supplements have the potential to improve the function of the oil glands and to improve the quality of the oil that comes out of those oil glands. Another one would be warm compresses or hot compresses to help those oil glands function better. And I have a few videos about this, how to do them correctly, and also a whole video on a dry eye routine that I actually do that helps my oil glands work the best. And so I'll put those links in the description for you. Now, the second reason is also kind of attached to dry eyes and meibomian gland dysfunction, and that is lid hygiene. Whether you have blepharitis from maybe an overabundance and overpopulation of bacteria that forms this biofilm on the surface of your eyelids, or you might have mites, Demodex mites that live on the eyelashes. Both of these can actually cause more crust at night. So the big one here is to actually clean your eyelids every night. This can include using eyelid wipes. I did a full video review on that as well, including in that dry eye routine video as well. And that can really help. You want to clean off all of your makeup that you have on your eyelashes and your eyelids. Now you can use baby shampoo to clean your eyelids, but there are much better options out there, like the eyelid wipes, or they have actually eyelid soap that you can use that tend to work better. It's more soothing. It's not as irritating as baby shampoo. Now, before we get to 3, here's a bonus one. If you're a contact lens wearer, definitely stick to the replacement schedule. If you need to replace your contacts every day, definitely do that. If you feel like you need to take breaks, definitely do that. Don't sleep in your lenses. The excess wear time of the contact lenses can cause more of that sloughing off of that top layer of the cornea, which can increase the sleep crust. Now, as a disclaimer, before we get into number 3, if your sleep or eye boogers are really getting out of control, it's maybe getting to the point where it's sticking your eyelids together, or maybe it's turning this greenish, maybe dark yellow color, it could be a sign that you're starting to get an infection, and would definitely be recommended to go into your eye doctor and develop a management plan or a treatment plan to get rid of that possible infection. And so if you can, avoid picking at the eye boogers. If you're getting a lot of them, start using a eyelid wipe or a warm washcloth and use that to kind of really warm the eyelids up and get that crust off. Number 3 is allergies. This can be simple allergies from cats, animals, dander. Outside you got dust, pollen. Anything that's normal can increase a little bit of a mucus buildup, which can create those sleep boogers. But it can also be from things that you don't think about. There could be dust mites on your pillows, your comforter, the actual pillow itself that you need to clean. And so think about things like that, because while you're sleeping, you could be exposed to that allergen. So if you can, and you know the allergen, try and avoid it. Make sure you're cleaning your pillowcases, comforters, and along the same lines of cleaning your eyelids, a lot of times those allergens can get stuck into the eyelashes. The eyelashes are kind of like the filter of the eye. So make sure that you're cleaning the eyelashes as well. You're cleaning that filter of the eye. And you can also look into using allergy eye drops. There's actually some good options that are over the counter. Pat-a-day, Lasticaft. Pat-a-day is 1 drop a day. You can put it in the morning or at night. It helps control itching and maybe keeps you from eye rubbing that can create more inflammation and dead skin cells. And so if you can put a drop in the morning, maybe you'll have a better result near the end of the day and when you go to bed. Remember, this is normal, happens to everybody, but if it gets out of control, talk to your eye doctor. Hope you'll like this video and stay focused.